Hi, my name is Ross Carter. I'm a patient of Mike Jones and also a masotherapist working in the same building. I was diagnosed with fibromyalgia in 1991 at the age of 27. I was referred actually to Mike by Dr. Leonard Nell, who is in the website as the physician, who has been documenting the cures that Mike has been able to accomplish. My onset of symptoms began back in 1986 with irritable bowel syndrome and Crohn's disease in 1988. Those symptoms discontinued in 1990, but unfortunately it was with the help of steroids, so that's not really much of a victory. It was really 1989, 1990 when the joint pain, muscle pain, exhaustion, all of that really kicked in. And that was at the age of 25, so it had been 2 years prior to my diagnosis. I'd like to go through real quickly a number of my symptoms because they were so varied. It really blew my mind at the time. Of course, sharp, dull aches throughout my body. They changed location, chest tightness, heart palpitations, extreme exhaustion, strange tingling sensations, pinpricks all over my body. I had decreased vision in one eye for some time and was diagnosed actually with multiple sclerosis for 3 weeks before they finally ended up ruling it out. And that was extremely scary. Numbing sensations, my skin, you couldn't even touch it, it was so sensitive. Of course, headaches, extremities would just fall asleep very easily. Burning sensations, range of motion, I'm sure everybody has got that. My eyes would feel so swollen, they feel like they were going to pop out of my head. I saw neurologists, orthopedists, a huge number of tests, body scans, you name it. And no, they couldn't find anything. And at that point, there was no such thing as fibromyalgia. And so basically I left with no diagnosis at all. Moved up here to Canton, got my law degree in Cincinnati, moved up here. And continued to try to work with it on my own. I tried stretching, weightlifting, physical therapy. Nothing worked, and as a matter of fact, often made it worse, and I felt numb at times. November of 1990, I started getting panic attacks. Same time, pain continued to increase. Then I started having the cognitive symptoms. As an attorney, you got to do some pretty heavy thinking with regard to the type of work I was doing. I couldn't understand anything I was reading. I'd find myself staring at the wall. I also started having seizures. And there was really no reason for the seizures that they could find, the doctors couldn't find. It wasn't your typical epileptic seizure. So finally I went ahead and left the law firm. I tried to just, in my own time, in my own speed, tried to make a living doing my own law practice, but that didn't work either. So by this time, Mike had, working with Mike, my pain was gone, but the other problems had remained. So I went back in 1995 and went to the Bureau of Vocational Rehabilitation in Ohio and had some psychoneurological testing done, in which my IQ had dropped within just 2 hours of testing from 145 down to 110, and that's pretty significant. So I was approved for funds to go back to school that they would pay for, and I chose to go ahead and get my masotherapy degree. Mike had done such a good job with me, and it seemed to be something I would be able to do and earn a living at. So I got my masotherapy degree, and I also did some little bit of legal work on the side. I was told that I was the only attorney in BVR history in Ohio to qualify for funding for a new career, that was not, physically, in a wheelchair or obviously disabled in that way. About that time, I suffered a whiplash injury and had to go renew my therapy with Mike. But this time it was different. It included not just the neuromuscular therapy, but also neurological techniques, and those had come from, Mike had done some consultations with Dr. Kurt Vreeland, who is board certified in neurology, and through Dr. Vreeland, Mike added some neurological techniques to turn on areas of the brain that just simply are not functioning in people properly. and which limits their ability to improve in areas other than just pain. So that was really a turning point in therapy for myself, and I think for many others also. So the focus really changed from the physical to the neurological at this point. Mike then later added additional things such as posture pump, I think I mentioned that earlier, nutrition changes, more adaptive stress coping habits, education, just understanding how this works. So by improving the functioning of the neurological system, then it allowed the rest of my functions to then normalize. So I again became pain-free, my cognitive abilities came back, but there was still something not right. I was still having some seizures. There was something missing, and Mike became aware that a lot of people had emotional issues that had really not been resolved, whether they were relationships or whether they were just things from our childhood. It just doesn't really matter. It's been proven by Dr. Candace Pert that those things affect the body a great deal, as well as the neurological system and thereby the functioning. So I started working on those, and then I just took off again. And so at this point I can do anything I want, mentally, physically. Now I'm going through maintenance right now, and as everybody should, who goes through the protocol, the maintenance is absolutely necessary because of the level of overstimulation we have. It's just very intense. Technology, stress, environmental factors, work. So regular neuromuscular therapy treatments. I keep doing the neurological movements, nutrition, adaptive coping strategies for stress in relationships. Those are all part of maintenance, and we should have those anyway. And without those, inflammation increases, and that disrupts the balance that I've worked really hard to achieve, and certainly that Mike has worked hard on my behalf. We all own things: houses, cars, airplanes, computers. They all need to be maintained, or they're going to give us problems. So if you have any questions, please feel free to email me at rcarterlegal, all one word, @gmail.com. Thank you.